Today's active lifestyle demands that we are in full control all of the time. Eating, talking, and smiling are just some of the activities where we don't want to lose that control. Your mouth is the focal point of your face. We come into life with a set of teeth which fortunately is replaced when they fall out. However, this second set is not naturally replaced when we lose them. Your teeth do not only serve you to show a nice smile, even though they are part of the entire beauty criteria, but they serve a much more complex and important role for our survival. Not having teeth or even missing some may be very embarrassing for people and stop you from living an active life to the fullest. What is worse than restraining yourself from going to a good restaurant or eating your favorite meal because you don't have teeth or because your dentures won't hold? What about talking in public? Have you ever been afraid of having your teeth fall out when talking in public? Now in the 21st century, there is a solution to that problem. But do you feel that only the rich and famous can afford it? Not anymore. Introducing Desert Dental Alternatives. And now your host, Trish O'Shea.
Hi, I'm Trish O'Shea here at Desert Dental Alternatives, which has become famous not only for its big white tooth outside that was sculpted by Dr. LeMay himself, but also for the revolutionary new mini dental implant technique that Dr. LeMay is performing here. He's helping hundreds of patients with dentures or missing teeth regain their ability to chew and bite into life again. Please join me for the next 30 minutes. We're going to talk with Dr. LeMay about that wonderful new innovation in the dental implant field, which is less invasive, quicker, and much more affordable than the standard implant technique. Dr. LeMay, thank you for having us in your office today.
You're welcome.
First, let's talk about how you got interested in the mini dental implants.
Well, I was at UCLA in 1998 after practicing for 7 years in Northern Canada. I went to do a master's degree and I got in touch with that new alternative. And I thought, oh my God, it's very interesting because I remember those days with all my patients with denture and all the problems they had, and they couldn't afford the standard implants to stabilize their dentures, or they would have only the dental glue to use. So I thought, oh wow, it's a good alternative for that. So I was very excited because you need to understand that those patients who have no teeth, they're facing a lot of problems with their denture. It's unimaginable what they're facing. We're talking from gagging reflex with their denture to not being able to chew their food, to stomach problem, all the way to swallowing the dental adhesives. So they have been struggling with a lot of problems, and I was very excited for a new alternative on the market.
The main problem in the industry for the average patient is money. That's an important problem. The price of the dental implants today still leaves treatment for many patients out of reach. The mini implant allows them at a reduced cost to get some support for their teeth.
So, Dr. LeMay, what is the main difference between the standard implant and the mini dental implant?
Well, the main difference is basically the size because they're made from both titanium. We need the first surgery to be placed and also a second surgery a couple of months later. There's some pain involved, swelling, stitches involved, and bleeding. There's still a good long-term success rate, over 90% with those large implants, but it will take between 6 to 12 months before you can use them. In general, for full jaw rehabilitation, it will cost between $20,000 to $40,000, depending on what kind of prosthesis you're using on it, if it's a fixed one or removable. As for the mini implants, they can be placed in general without any surgery involved, so generally painless with no swelling or bleeding. The long-term success rate will vary for the lower jaw about 98% up to upper jaw 70 to 90%. They can be used as soon as they're installed. There's less risk of infection. So finally, the cost of those mini implants compared to the standard implants will be much less. It will cost between $4,500 to $7,000 to rehabilitate a full jaw like a denture over implants for a patient to be able to chew again.
But Dr. LeMay, which is the best technique, do you think?
Well, in a perfect world, if everybody could afford the price of the big implants and if their health would be good enough to stand for the big implants, that would be the best. That would that's what would bring the patient to the closest to their natural dentition would be to have fixed implants and fixed crowns on it. But as we don't live in the perfect world, we have to live with dentures. So at that stage, the best technique to stabilize denture, in my opinion, is the mini implants.
Desert Dental Alternatives did give me alternatives, and I appreciate it so much. As a retired person, I don't have a lot of money to spend on dentistry or cosmetic dentistry, but I appreciate the fact that he could save my teeth and just put a fixed bridge in my mouth, as opposed to spending $20-some thousand on large dental implants.
Well, I was having problems with my lower teeth, and I wasn't satisfied with the dentist I went to. They weren't fitting right. And I heard about Dr. LeMay with the implants. I left with the same teeth, and they were much better than they were when I walked in.
The reason I got the mini implants is because I didn't want to take the time to go through major surgery or the downtime of about 9 months of waiting for your gums to heal to go further with it.
If I'd have known it was going to be as easy as it was, I probably would have done it 3 or 4 years before.
Now, you're saying that you prefer to use the standard implant for a full jaw of fixed teeth, and then the mini implant for the stabilizing the dentures. Can you use the standard one for that too?
As a matter of fact, that's how we used to do it before the invention of those mini implants. And there was 2 ways we used to do those large implants to stabilize denture. The first way was with 4 standard implants joined together with a bar, and then in the denture, the snap were incorporated inside, and then the denture just snap on it. But with that procedure, it makes it's still surgically, so the cost is very high, and it's much harder for the patient to clean. They have to floss under it. As for with the mini implants now, they're much smaller, as you can see the difference, and they're still snap in the denture, but because they're smaller, it takes just a single little toothbrush that goes over it, and it takes a couple of seconds and they're clean, so there's less risk of rejection or infection of the gum with that. The other technique we had was to use just 2 standard implants per jaw and stabilize the denture over it with some snap, but because of the cost, patient couldn't use 6 implants, so by using only 2, it was creating a lot of pressure on those implants, and the bone gets lost. You lose bone around those implants because of the pressure. So there was some rejection involved. So with that case here, we can see a lot of rejection on those implants. And what we had to do is to fix that with mini dental implants. So we were able to use 6 mini implants on the upper jaw and 6 mini implants on the lower jaw, and then the dentures are more stable. We'll remove those standard implants eventually and graft some bone and place some more mini implants, but that's the way we used to do it before.
I went to one dentist and had 4 implants put in. They're not taking now. And at the cost of the price, when they told me how much it was going to cost for a full set of teeth, I just had everything stopped because it was too expensive. I couldn't afford it. The bigger implants, they're just falling out. They didn't take. So I paid all that money for 4 implants that are now rejecting, or have been rejecting. And the mini implants, I have no problems with them. I haven't had a problem, and I've had teeth now, I do believe, for 3 months now. I'm very happy. I am so happy. I don't know what I would have done if I did not see the commercial about the mini implants.
So are you saying that you can even lose the standard implants?
Yes, as you just saw on the X-ray, it's not because they're bigger and more expensive and placed surgically that they have a better result. They can be lost the same way that you can lose any other implants. So let's look at this case here where you can see the patient invested a lot of money, over $15,000 on all those implants and those fixed restoration on it, but it didn't prevent him from losing them after a couple of years. So there's a lot of bone loss around those implants, and the side effect of that is there's nothing else we can do after that, compared to if you lose the mini implants, they're so small that the bone regenerates and you can use a new one again.
But Dr. LeMay, weren't you a little afraid, at least in the beginning, of using these mini implants because it was such new technology?
I was very excited, but I was not ready to start using it on patient right away. I wanted to testing it, if you want to say. So I was trying to find someone that I could use as a guinea pig. So I called my mother in Canada. She was a perfect candidate for that. She was at that time 77 years old, and she was having problems with all the problems we discussed earlier with dentures. She was having all those one. She couldn't afford the standard implants. She didn't want to refinance her house, and I understand. And that was the perfect candidate for that.
I am Dr. LeMay's mother. He called me in 2001 and wanted to do many implants on me. My dentures feel like my own teeth. They don't hurt or move anymore. I am very happy. He used me as his guinea pig. After the implants were put in, my confidence level as far as my appearance went up dramatically. I smiled bigger, I laughed harder, I wasn't self-conscious any longer about the space that was there in the teeth.
So I went to Dr. LeMay, and he almost guaranteed me no pain, and he was exactly right. We did it in one sitting, and I had no swelling, no suffering.
All with very little pain. The implants don't hurt at all. It's just fabulous, it really is.
So Dr. LeMay, let me be the devil's advocate here for just a second and ask you, are the mini implants approved and legal?
Well, they've been approved since 1996 for long-term use. That was the first company approving it. And recently, another company has just been approved by the FDA again for long-term use. And what's fun is that that second company actually used 100 of my patients to get their implants approved.
So it sounds like you have played a big part in having the FDA approve the mini implants.
Yes, with the second company, what happened is after I started using it and believe in that and had success, I've done a lot of those cases, and someone heard about my results and he called me and he said, well, what have you been doing, and can you work with us to get our implants approved? So we took under my patient and made the research with them for over 5 years, and were able to help them to get their approval.
And we're going to go to Florida now to see what the manufacturer has to say about Dr. LeMay's success with these mini implants.
We've been working with Dr. LeMay for many years. I think we're in the 5th year. And we started a pilot study with a group of dentists, and Dr. LeMay is one of those. And we are following up his cases every year. And the statistics that we got show us that Dr. LeMay is within the top notch of the practitioner in terms of success rate. And it means that he's using the right product in the right indications, and that's why he's getting those good results. Dr. LeMay understands exactly the importance of primary stability when he places the implant before he restores them, and that's one of the reasons he has such a high success rate.
So Dr. LeMay, now that the FDA has approved the mini implants, they're more affordable, they're easily placed, what type of patient best benefits from them?
Basically, patients with full dentures will benefit a lot of that procedure. But because of the success I've had in other dentists too, we now use it for stabilizing partials and also for single teeth replacement. Before going forward, I would like to go again with how they're placed so you can see how easy they are again. So still under just standard anesthesia, we're going to drill a little hole over the gum and the bone, and slowly the implants can be placed just by screwing the implants in the bone. So we can repeat that procedure 4, 5, 6 times. Once all the implants are there, we just put a little snap over it, and that snap is incorporated either in the whole denture or in the new denture, and then the patient can start chewing on those. If we look at the samples of the jaws, just to show you how they resorb over the time, you can see here that that's a very recent extraction sites where the jaw is very large, and as the patient wears the denture, the jaw resorb, and we arrive here with that extreme resorption where the patient can barely wear anything in their mouth. There's no way we can wear the denture there. If we look at the samples of real cases, ears with a standard jaw with a lot of bone, we can place on the lower jaw a lot of mini implants, even in the posterior jaw, which helps the denture to be very, very stable. This second case here is where we don't have enough bone in the back to place implants, so we just use the chin area Finally, this third case is the extreme resorption when a patient has been wearing denture for years. And even with the big implants, there's no way we can place any implant there because there's no bone at all. So if you look at this case, what we were able to achieve is we can stabilize the denture with 6 mini implants. They're shorter, but they're very strong because that bone is very hard. And the patient has been able to chew nuts for, that she hasn't been able to do for years, and she's very happy. This is the case that the patient benefits the most of the mini implants because they've been suffering for so long. To be at that point of resorption, they have the denture for over 50 years. So that's the case where they benefit the most for mini implants and stabilization.
And what about the upper jaw, Dr. LeMay?
Well, the upper jaw brings a different challenge because of the density of the bone. The quality is not as good as the lower jaw, so we have a different challenge there. Let's first look at the different jaws, how they resorb over the time on the upper jaw. A fresh jaw that was just extracted, you can see the large ridge, and as the patient wears denture, you can see the ridge gets thinner and thinner and thinner, and that causes a problem to place implants. Very often we don't have the quality of bone enough for that. But if we do have the quality, let's say we have the quality of bone, here's what it looks like on an X-ray. This patient here had a very, very good bone on the top, so we were able to place many, many implants. And the good thing about that is what we can do with the denture. If you look at those two dentures here, one is when we have mini implants and the other one is without mini implants. So we have to keep a lot of acrylic to hold the denture in place when we don't have mini implant. As well, when we have mini implants, we can reduce all the acrylic and the patient has a better feeling in his mouth, much smaller denture, more stable, and the palate is all empty, so the patient has a better taste in his mouth because there's taste bud in the palate too.
I went to another dentist and I had my dentures were made. When I went to Dr. LeMay, he used my original dentures. They don't bob up when I talk and when I eat anything. And I can drink coffee and I don't have that taste of the glue stuff.
The benefit of having the mini implants is that they're done immediately. Under local anesthetic, they insert the little implant things and the teeth snap right in and you walk out of the office the same day that you have them done. And basically there's very little swelling, no pain, at least with me, involved, and you can just go back and eat everything that you used to eat before you lost all your teeth.
A lot of them, when they come back, they're just so ecstatic of the final result that they're able to chew properly, and that's the bottom line, being able to enjoy your food and not having to have a denture be loose.
Now, that sounds great, Dr. LeMay. What about the long-term success rate, though?
In my hands, what I can tell you is the result that I've been having for the last 7 years. I've done over 2,500 cases. On the upper jaw, it varies between 70 to 90%, depending of if you have to do some work on the sinus or not. I don't want to be too technical, but the success is between 70 and 90. As for the lower jaw, my success rate has been over 98%. So we're talking long-term, we're talking years, we're not talking months. That's in my hands, though, but I cannot talk for anybody else, but for me.
We can deliver consistent products, and Dr. LeMay understands exactly how to use them, so he has a high success rate. The price of the dental implants today still leaves treatment for many, many patients out of reach. The mini implant allows them at a reduced cost to get some support for their teeth, and that's very important.
I have been in the dental field for 26 years. I have worked in various offices that have placed mini dental implants. The success rate that Dr. LeMay has had in this particular practice versus the other practices is so much higher.
We decided to do the mini implant on that tooth. And I've had it for 5 years now, and I've had no problems with it.
I actually have recommended the procedure to several people who have gone to Dr. LeMay, and all of them have been equally as happy as I have been. It's a really good procedure. It's something that anyone who wants to improve their quality of life without going through a lot of pain should think about.
He brought in a set of teeth that were just teeth and nothing that fit on the gums or went up the side of the gums that could make anything uncomfortable, and the teeth just snapped into place, and they were below the gums, and it was just absolutely perfect.
I'm sure there's some people out there who are wondering, how about if I just need a single tooth replaced? Can you do that?
Yes, of course. This case here that I'm going to show you is a perfect case for that because the space is very small, the bone is very dense, and even with a large implant there, you probably would not have enough space to place a large implant there, so you have to go with something small. This one here was placed a non-surgical way. We can place a crown, a fixed crown on it almost immediately after a week, and the patient can chew on it without any surgery and for a lower cost.
Of course, cost was a factor for me as well, so we decided to go with a mini implant. Dr. LeMay said that he thought that that would work, even though I was different than his regular mini implants where, I don't have a denture or anything like that or a partial, but he said that it would work for an individual tooth as well. So we tried that, and I've had it for 5 years now, and it's been perfect.
Dr. LeMay, what if a patient is losing all of his or her teeth and facing dentures? Would this patient benefit from the mini implants?
Absolutely. And it happens very often. And what you need to understand is those patients who are facing that in their life are very scared because they've seen what happened with their parents when they lost their teeth. They've seen their health degenerate, and they see the glue that they have to use for that. And they're very scared of what's going to happen. Let's go to a case and we'll show you how it's done from A to Z. So if you look at this x-ray here, you see the patient has lots of gum disease, and it's obvious that he's going to lose all his teeth sooner or later. So the way we work to achieve success is we pull all the teeth, but on the lower jaw, because of the quality of the bone, we're able to place some mini implants right away and stabilize the denture right away. On the upper jaw, it's a different challenge. So when we pull the teeth, we have to fill the socket with bone grafting. And then a year later, we can go back and add some more implants on the lower jaw where the bone healed and fill all the upper jaw with a lot of mini implants. And then the patient now has 2 dentures stabilized with mini implants, and they can eat with firm dentures in place instead of using the glue.
So tell me, Dr. LeMay, what sets you apart from other dentist offices who may, in the future, offer these mini implants?
Well, the main thing is basically experience. I've done over 2,500 cases for the last 7 years with 98% success rate. So I think this is hard to beat. The other difference will be that I'm doing the big implants or the mini implants. So if you want to have all the alternatives, you need to go somewhere that are successful in both and not just for offering one option. The other thing also is that everything is done here by the same person. So one person is responsible for your case from A to Z and know your case completely. And then finally, whatever you decide, if you decide to go with the big implants or the mini implants, your decision will be respected.
There's various options depending on their dental needs. Dr. LeMay will give them every single option that is available to them, and we will respect whatever it is that they choose to do.
I've been to almost every dentist out here, and he is the only one that I'm very happy with. I was very happy with when I walked into his office. He explained everything to me very well, very carefully. I could understand it. And he showed me, we took the x-rays, and this is what I wanted to do. The mini implants were for me.
Let's say that someone is looking for a new dentist or they're moving into the area. What type of criteria should they use in choosing a new dentist?
Mainly the main criteria would be someone who is artistic. You need to understand that dentistry is an art, and the final result you will get may be very different. Here's an example of a patient who needs a denture. You can see on the first picture on the left that she needs a denture and her profile is very concave. With a regular denture, with a standard dental office, you can get a functional denture that will rehabilitate her jaw and help her profile. Finally, here in the last picture, you can see that not only the patient has been restored in her denture, but her facial expression is much better. She looks almost like she had a facelift without any surgery. So with an artist, you can get not only a regular denture, but you can get improvement on your cosmetic as well as your function. You also need a dentist who's updated with the technology. Now we have laser dentistry, we have digital x-ray, we have computerized office, we also have intraoral camera. But you need to be careful. Don't be fooled by the technology, because it will never replace the 2 hands of the dentist. You also need a dentist who's open-minded, which means that he needs to be willing to try new techniques. As an example, today we talked about the mini implants. If you look at every magazine today, every dental magazine, they're there. So they're here to stay. So you need to find someone who will be willing to try those new techniques so you have all the alternatives. You also need a dentist who is perfectionist over limit and who will not go with just the acceptable, but try to reach for the exceptional, especially when we're talking about cosmetic dentistry. I have an example here of 2 porcelain crowns. If you look at those carefully, you'll see a big difference. The one on the left is nice, white, very opaque, and this is pretty much what you're going to get as a general crown. But the one on the right side is much more natural looking, and to achieve that result, you really need to find a real perfectionist who will be able to reach more than the acceptable and make it very natural. You also need a dentist who will really offer you alternatives for your problems. As an example, if you're scared of dentistry, there's a lot of options an office can offer you to go over that fear. You also need to find a dentist who will respect your limits. Find a dentist who will find alternatives that suit your budget. Also, make sure you find a dentist who will be happy to give you referrals for the kind of treatment that you need. And finally, try to find someone who will really care for you and for his patient in general.
The great thing about Dr. LeMay, he called me from San Francisco the day after he put the implants in just to see how I was doing. Now, how many doctors do you know would take the time to call you?
Well, Dr. LeMay, thank you so much for spending this time with us today and sharing some great information. Obviously, you're changing the lives of so many people here in the Valley.
I hope I do. And I'm very pleased that I was able to explain, people a little bit more about those mini implants, because there's a lot of misconception around that procedure, and people need to know that there's new options for them, a new alternative, less expensive, less painful, and that it works.
Thank you.
He takes very, very careful care to ensure that they fit correctly, that they snap into place correctly, and that you don't have any movement. No, I don't even know they're there.
I've had them for 4 years and I still have had no problems. And I think Dr. LeMay is a very good dentist.
I'm in front of the public all the time, and I have to hopefully look my best at all times so I can smile and not this. So it worked for me, and after Dr. LeMay explained it to me and told me how much there would be no downtime, that was it. I was convinced, and I've never regretted it.
What a better greeting in the morning and then to say good morning and have a nice smile on your face. But I feel anyone deserves to have a nice smile, and they deserve to see Dr. LeMay and have these implants done. If they're thinking of any type of procedure to replace maybe your teeth that you've lost or whatever, see Dr. LeMay. He'll fix you right up.
My sisters made a special trip just to drive out here from Canyon Lake, Temecula, and just to see my brand new teeth. And they're jealous because my teeth are prettier.
I couldn't do this before.